I'm going to be quiet. In a couple seconds, we're going to officially now start recording. Welcome one and all to this Your Impact Collaborative at Your Women's Fund. We have it very clear that every time we meet every month, this forum is about you, and you, all of us who make up the very everyday stronger fabric of Miami-Dade County. We gather here to focus a gender lens. With a gender lens, we can see what specifically we can do to support women and girls in Miami-Dade County. And with that, lift all boats together. We find many lenses are important, and you're going to see some really important lenses focused today. It's a special day and a special format. But first, I want to thank everybody who makes this possible. And I'm going to start with the team today. Team, love you. Very, very rock and roll. You're all the best. Our incredible board who really work and really participate. Many of you are here today. Our interns are a force. So this is no regular internship program. This is a peaceful army of brilliant young minds who are doing very serious work to move all of us forward. So we see you and we thank you. And then everybody needs fuel. So We Count needs fuel. We're going to hear from We Count soon. Citrus needs fuel, but Citrus actually is our partner in health and well-being. So they are a pillar sponsorship for this, one of our 4 pillars, health and well-being. And we are eternally grateful, not only for the fuel and support, but for the work we do together day in and day out. So I'm going to talk about the team. Teamwork is the dream work. Viviana is going to drive everything today. She's leading this Impact Collaborative, and she's going to talk more about team and give you some exciting new news. So Viviana, please take it away.
Thank you so much, Maria. Good morning, everybody. For those of you that do not know me, my name is Viviana Alvarado Pacheco. I am the Director of Research and Policy here at Your Women's Fund. And today I have the pleasure of engaging in this wonderful conversation and moderating the panel. But first off, I'd like to give a great welcome to our newest staff member, Val Butler, who is our AIM Project and Grants Manager. Val just joined us a couple of weeks ago, so we're really excited to have her going. And you might be asking yourself, okay, well, what is AIM? AIM actually stands for the Alliance for Infant and Maternal Health Miami-Dade, which is our newest initiative. And it's an initiative whose mission is to accelerate the measurable reduction of maternal and infant mortality and morbidity in Miami-Dade County through cross-sector collaborations between private, public, large institutions, and community-based grassroots organizations that are doing maternal health work. So we're really excited. And this work actually started back in 2020 when we had our first Impact Collaborative on the effects of heat on health. And from that conversation, we also launched our public awareness campaign around extreme heat and pregnancy health. If you haven't seen these around town, please make sure to be on the lookout now because they are out right now. And our public awareness campaign highlights this extremely important issue, which not a lot of people know about. Pregnant people are most vulnerable to the effects of extreme heat, and it's something that we are shedding the light on and continuously disseminating information on. You can find out more information also on our website, which is womensfundmiami.org/heat health, but there's also going to be a link in the chat. And our campaign is available in our 3 languages, so English, Spanish, and Haitian Creole. With that, it is also my absolute pleasure to introduce Zainab Jab, who is going to be talking to us more about this important issue and really grounding the conversation. Welcome, Zainab.
Hello, everyone. Good morning, and thank you so much for joining us today. My name is Zainab Jab, pronounced she, hers, and I'm the Associate Director of Research and Development at the Praxis Project. Next slide, please. So I'm just going to ground us in the snapshot of health heat, and justice, and how that impacts pregnant people in Miami. Next slide. So a little bit about me and how I show up in this work. I always feel like it's important to provide this information, but I really take an intersectional approach to this work, going by Kimberly Crenshaw. And that really is looking how different identities intersect to shape your experience that you have within systems of oppression. And so I show up in this work. I'm first generation. My father's from Sierra Leone. My mother's from Puerto Rico. I grew up in the South as a Black woman. I'm Muslim. There's like all these intersecting systems of oppression that have shaped my experience and how I show up in the world. And I've also recognized my parents come from lands that were colonized, and I've seen the ways in which that has a direct impact on their health and the resources they have and the social factors they have as well. So all of this has shaped the way I do my work. I use a reproductive justice lens in my work as well. Reproductive justice is a framework that really centers bodily autonomy and really highlights safe and sustainable communities to raise children. So that is a direct factor and exactly why I utilize the reproductive justice framework in shaping my work. And I also do community-led research. So I see myself as an intermediary or bridge between community and uplifting them in policy, academia, and healthcare. And a majority of my work is really thinking about how to co-collaborate research efforts alongside community and translating findings directly back into the community as well, where there will be a direct impact. So all that being said, just wanted to provide a snapshot of extreme heat right now in Miami and its impact on heat, on health. So as you can see here, this is from the National Weather Service. I know you all probably know the NOAA, which is a part of it's the overall agency. They have been receiving some cuts in staff. So what ends up happening is there's reports of the weather reports being a bit off. However, I was able to take these screenshots a couple of days ago to show what the weather would look like this afternoon in Miami to just give a real-time update. So max heat index is defined as it measures how hot it feels by combining both the temperature and humidity. And so as you can see here, Miami-Dade is very red. Next slide. This is the maximum heat risk. And so National Weather Service, they assess heat events from 0 to 4, and higher values signal increased risk of heat-related health impacts, infrastructure strain, and disruptions, especially for vulnerable populations who we're speaking about today. Next slide. And visually, if you see here, the yellow and orange are ones that are highlighted, where there's minor and moderate, but also stating that there are folks who are extremely sensitive to heat, they are in danger. So this highlights another risk. And then lastly, a wet bulb globe temperature risk, it's a mouthful, measures heat stress by considering not only the temperature, humidity, wind, solar radiation, etc. And this really impacts measures for work schedules and ensuring that folks are protected as it relates to the weather. And it's high. It's a whole lot of red. And when you see the effects and precautionary actions there, it provides some insight on how much sunlight you should be getting. But we all know that that's very hard to do if you have to walk places, if you're working outside, if you're working indoors where it may not have accessible AC. So there's different factors that impact extreme heat and how it exacerbates health outcomes. And so this slide is very large, but I feel like it really provides a great visual of the way in which climate change directly impacts human health. And when we're looking at extreme heat, the directed human health impacts are heat-related illnesses and death and cardiovascular failure, which is really important when thinking about maternal health. But all of this is very cyclical. So all of this interacts and impacts one another as well. So thinking about floods and how that can relate to like vector-borne diseases. So all of this is very important in thinking about the overall well-being of maternal health. And so another snapshot of maternal health in Florida, the March of Dimes, they create a report card to just look at the collective factors that have contributed to maternal mortality or morbidity. And so what you see here are some rates on preterm birth, preterm disparity ratio, infant mortality, et cetera. And it compares it from year to year. And so as you see, there are some parts that have improved, but there are areas that have worsened. And here I wanted to just highlight Miami-Dade's, some Miami-Dade data around preterm birth. And also on the right, you can see that there are many findings around preterm birth that really highlights the racial inequities that are present in maternal health. So we're in a maternal health crisis in the US. Black women are more likely to die. And so as you can see here, we have the preterm birth rate among babies born to Black birthing people is 1.5 times higher, and the infant mortality rate. They also provided a blurb about extreme heat. So that's how you know, like, it's one of the top things that folks are really looking at and how it's greatly impacting maternal health outcomes. And so thinking about that, I also wanted to highlight some research from the Women's Fund that found that Black women in Miami-Dade experience the highest mortality, maternal and infant mortality, and have the lowest rate of adequate prenatal care. So that's really important to think about in thinking about that intersectional approach and what are these Black women experiencing as Black women within these systems that's leading to this and the systemic racism. But there's so many other factors at play as well. And really thinking about those who are vulnerable to the extreme heat, which tends to be low income and minority and racialized neighborhoods, and they have lack of access to cooling resources or tree cover, so it's extremely hot, and they end up being in urban heat islands. And so what I have pictured to the right now with our current administration, there are a lot of shifts and cuts to really important resources. So one of them is the Low Income Home Energy Assistance Program, and that provides support with paying for energy bills. And if you think about extreme heat, you want AC and you want it blasting for very long, but that may not be a reality and a resource that folks are able to have. Next slide. And this is more recent news with the big, beautiful bill and thinking about the direct impact it will have on health outcomes. So rising costs and energy bills, which again, folks may not be able to afford their AC being on nonstop. Health risks, so gutting pollution programs will worsen air quality. And all of that, as I mentioned, is all interconnected. Safety threats, so cutting clean energy will strain the electric grid, which again, could lead to power outages, which is a health risk, and thinking about AC needing and cooling needed during pregnancy. There's going to be a lot of environmental harm and just long-term damage overall. So we are really at a space where there's already existing maternal health crisis. Extreme heat is just going to get worse, and we're getting resources cut. Next slide. But regardless, we still have to protect pregnant people. So something that I work on that folks view as innovative is birth workers as climate frontline workers. And folks are starting to make the connections between, oh, community-based doulas are trusted in their community. They are aware of resources, and they are directly supporting their clients throughout the duration of their pregnancy. And they have a lot of touch points with their clients versus how many touch points the client would have with the healthcare system. Next slide. And so just to define a birth worker, basically they're from the same communities, they support with language and cultural barriers when it comes to pregnancy care, they provide social support, connection to resources, and midwifery-led change and doula care all have shown an improvement in maternal health outcomes. So they are really crucial in really supporting pregnant people throughout the duration of their pregnancy. And we recognize that this is a unique opportunity to be able to better support pregnant people. So I was able to do a survey 2 years ago that basically just asked doulas and birth workers nationwide, are you concerned about climate change? Do you see climate change already impacting your clients? Do you want resources? Are you interested in training? And overarching, everybody is like, yes, I see it. Yes, I'm stressed. Please give me resources. And so I'm like, okay. I thought that would be the reaction, but it was really validating to like hear and see and see the concerns of folks and actually read what are happening to the clients across the US, which, there's wildfire, extreme heat, flooding, hurricanes. So yeah, next slide. I'm not going to talk too much about this because we have Dr. Holder on the panel, but I have the pleasure of working alongside Dr. Holder on the Doula CHOP program led by Florida Clinicians for Climate Action, and it's adapting an existing program to train those in climate education, but adapting it for doulas. And so providing those direct resources to doulas to be able to best support their clients. Next slide. And this is something I'm super proud of. As I mentioned, my family is from Sierra Leone, and Sierra Leone has drastic weather changes. They have a heat season and a rain season, and the heat is really intense, but this is just showing an example of the type of research that can be done. And I actually started this because I remember reading that there is a heat chief officer in Miami, and then seeing there was one in Freetown, and I was like, that's where my family's from, and this could be a really cool connection, and really think about the transnational approach and experiences of women within borders, across borders. So this is a project called Place de Hato, which basically means the place is getting hot in Creole, which is the dialect in Sierra Leone. And we realized there aren't words to talk about climate change in Creole. So we took a step back and just created this and hired a local artist so women will be able to see, and pregnant people will be able to see themselves in the visuals. So this is an opportunity for folks to even get an understanding of what climate change is. So, and then we trained TBAs, that's their doulas, traditional birth attendants, and nurses and midwives to be able to provide these insights. There's a lot more pictures and report coming soon. But just wanted to show you a few examples of the way in which we can best support pregnant people as it relates to extreme heat. And so what I hope you could take away from this is what's needed to really work on this intersection is a justice-based approach and recognizing that extreme heat is exacerbating existing inequities. You need to invest in community and local leaders. They have the solutions, they know their community, and it's important to work alongside them and provide resources to them, along with community-driven solutions. And the call of action is to just listen to folks impacted and collaborate with them in thinking about the ways in which we can best protect them from extreme heat. Thank you. This is a QR code. I've created it whenever I do presentations. It's just a whole lot of resources on this intersection if you're wanting to read more. And some of the reports that I have mentioned will be in this QR code as well. Thank you so much.
Thank you so much, Zainab. That was wonderful. Thank you. Thank you. Such wealth of information there. So moving along, we're going to have a very special speaker coming up next. This speaker, she is going to be speaking in Spanish. So bear with me as I guide you through how to put translations on your Zoom so that you are able to do the closed captions and see the translations live. I will say they're not the best, so we're going to do our best here, and I might jump in as well to translate a little bit. But first of all, please locate your captions icon at the bottom of your Zoom toolbar. Once you do that, it might be also in the More section, so make sure you look there. Once you see that, you want to go into Show Captions. There also should be a little icon for you to turn on translations. Once you turn on the translation, you want to make sure that you translate into your language, whether that be English. I'm not sure if it translates into French or anything else, but English for now. And so once our speaker starts presenting, you should be able to get those translations and closed captions in English. We're giving this a trial run, so please bear with us as we kind of juggle through. If you have any questions, please drop your questions in the chat. Our team is ready to help you and guide you through on how to turn these translations and captions on. All right, so moving on, our next speaker is Lidia Lopez. Lidia is a nursery worker, and she's going to be sharing about her lived experience and sharing all of the information that she has. Lidia, bienvenida.
Ya. Muchas gracias. Mi nombre es Lidia López. Soy de Guatemala. Soy una persona que ha trabajado en nurseries en el campo. ¿Sigo?
Sí.
Ok.
Yes. Go ahead, keep going.
Ok. Bueno, primero voy a contar un poquito de mi historia. He trabajado por 6 años. Cuando llegué en el 2003, empecé a trabajar en una nercería. Eh, Todos los 2 embarazos míos fueron eh, trabajando en el campo. Entonces voy a hablar un poquito o voy a contar un poquito de mi historia, compartiéndolo con ustedes. Cómo es trabajar en el campo y cuál es el trato de los supervisores que nos toca a cada área en los nurseries. Bueno, a mí me tocó con el primer embarazo. Es muy difícil, en especial porque nosotras como mujer, cuando estamos embarazadas, nos volvemos un poquito más sensibles en mucho, a veces emocionalmente, físicamente también, y no podemos dar el mismo trabajo lo que da una persona que no está en estado, eh, pero nos obligan a hacerlo y tenemos que hacerlo porque lo necesitamos, porque como personas como yo, bueno, hablo de mí, yo vengo por pobreza a trabajar, tenía mis padres, tenía que ayudarlo, no me obligaban ellos, pero yo al estar aquí, yo quería ayudar a mis padres, pero estaba en estado y trabajé mis 9 meses de embarazo y fue muy difícil porque a veces los supervisores no nos ponen agua. No te dicen en un momento, llega eso de la 1 de la tarde, las 2 de la tarde, que se pone muy fuerte el calor. No nos dicen salte un momento a agarrar aire o, mm, o tómate 5 minutos de descanso. No tenemos eso y tenemos que seguir trabajando. Ahora mi segundo embarazo fue mucho más peor, como que no tenían consideración, a veces ni siquiera te entienden cuando tienes que ir al médico, tienes que presentar papeles, si no entregas un documento donde diga que yo fui al médico porque necesito ir al médico por mi embarazo. No te tienes que tener ese documento en tus manos, porque si no, no te lo creen y am, no te dan ese permiso para ir a las citas médicas. Entonces es muy difícil, especialmente como que con mi segundo embarazo el trato fue aún más peor que con el primer embarazo, como que ellos han aumentado ese abuso con las mujeres embarazadas o con todas personas, especialmente como nosotros somos inmigrantes. Ellos han puesto eso más peor cada día que pasa. Está aumentando más el abuso. La gente cada día más no nos comprenden a la hora de pedir un permiso, ir al médico, muchas cosas cada día entienden menos. No comprendo, estoy platicándolos o contando mi historia, no comprendo eso, porque ellos no comprenden esas cosas. Y ellos como que no les importa ponerle el agua a tiempo a la gente, en especialmente cuando llega a las 8 de la mañana. ya nosotros estamos trabajando ya muy fuerte, empezamos a las 7:30 y eso, unos calores, las humedades son tan fuertes que no sé, el cuerpo de uno te pide mucho líquido, mucha agua y no ponen el agua a tiempo. Ellos llegan hasta las 9. Eso no, eso es muy importante el agua para la gente que trabajan al aire libre. Pero es algo como que ellos no lo comprenden, en especialmente la gente que nos ponen a supervisar los trabajos, porque ellos están ahí, pero ellos no están haciendo el trabajo, a veces están parados, están sentados o dándote órdenes. No es igual que tú estás haciendo el trabajo. El cuerpo, aparte de que el tiempo es muy caliente y el cuerpo está al movimiento, produce más como más calor y tú quieres tomar agua, como que tú quieres ir a tomar agua cada 10 minutos y te tomas el agua como que si fuera, te tomas una botella de agua como que te estás tomando eh, como dos traguitos de agua, porque el cuerpo como que lo necesita, no sé. No sé de dónde sale esa ansiedad por el agua en uno cuando uno trabaja en el campo. Y es algo que deberían de entenderlo como en estos tiempos. Yo pasé mis 2 embarazos en estos tiempos, en el mes de mayo y junio y julio. Entonces yo he experimentado esos calores, lo fuerte que es para la mujer en estos meses. Y no solo en mujeres embarazadas, sino también en personas que tienen a veces como enfermedades crónicas como la diabetes, como la presión alta, presión baja. Todo eso le afecta muchísimo a la gente. Eso de no tener el agua desde que la gente empiezan a trabajar. Eso hasta les puede causar una muerte allí a esas personas, porque eso es muy, la gente no comprenden eso, el tener el agua al lado de la gente que trabajan en el campo y mucho abuso y por lo mismo también la gente a veces no se atienden, no van al médico porque no tienen el permiso. Ellos, si hay alguien que se siente mal, ellos al siguiente día piden un documento para dárselo al supervisor. El supervisor lo pasa en la oficina con otras personas que nosotros no conocemos. Pero hay veces que nos hemos sentido muy mal por el impacto del calor, de lo caliente que está afuera. Sabemos por qué nos ha pasado, sabemos que es por el calor. Y no debemos correr, ir al médico, porque si vamos al médico, ya sabemos lo que va a decir el médico. El médico va a decir que descansemos, que tomamos agua, que entre muchas cosas, pero no, entonces, evitamos ir al médico porque aparte de eso que tenemos un ingreso muy bajo, no nos da para ir como cada mes al médico. Y a veces ahora, en este tiempo, deberíamos de pagar un seguro. A veces ni siquiera nos quieren vender un seguro médico porque no tenemos ningún documento en este país. Ellos dicen, paga seguro y tú acudes a lugares a donde venden seguro y uno sale diciendo, no, es que no tengo un número de social, o no, es que no te puedo vender así. Entonces, no podemos. Debemos de pagar un médico que tiene que ser en efectivo. Y a veces no contamos con todo ese dinero para pagar un médico porque sabemos que en este país eh, es un país muy bueno, pero también las cosas son muy carísimas y personas que trabajan en el campo en realidad tienen un ingreso bastante bajo. Es por esa razón que debemos buscar casas, lugares donde nos cobren un poquito menos, porque no podemos irnos en un lugar donde no podemos pagar. Entonces, es la razón que la gente no acuden al médico, es la razón que la gente no pueden entregar un papel de un médico al siguiente día. Eso yo siempre lo peleaba con personas donde yo estuve trabajando. Yo no puedo traerte un documento porque no puedo correr mañana al médico. Yo sé por qué me pasó esto, pero es algo que ellos no comprenden. Y cada día más es peor para la gente que trabaja especialmente en nursery.
Muchísimas gracias, Lidia, por compartir tu historia, tu realidad, la realidad de muchos que trabajan en el campo y por compartir algo que pues yo ciertamente sé que no es fácil. Te lo agradecemos de el profundo de nuestro corazón. Muchísimas gracias también por estar aquí tan temprano en tu día laboral. En verdad que te lo agradecemos. Nos has dado mucho que pensar y vamos a seguir con esta conversación para poder aprender y seguir mejorando las condiciones para todos los que están trabajando en el campo, como tú. Muchísimas gracias.
Gracias, gracias a ustedes.
Thank you so much, everybody. We apologize if the translations were not super well off, but hopefully you really got to understand and got to ground yourself in Lydia's story and her struggles and the struggles of all of these nursery workers that are out there providing the food for our community. I want us to keep going. We want to hear from you. So please keep in mind that there will be 3 polls throughout the continuation of the Impact Collaborative, and we're going to have great conversations moving forward. So I want to launch our first poll. Please make sure to fill it out. And we're moving on to the first section of our panel, which is introductions. We're going to be asking our 2 panelists today to introduce themselves in 2 minutes or less. Hard ordeal, I understand. And first off, we have the amazing Dr. Cheryl Holder. Welcome, Dr. Holder.
Hi, good morning. Thank you for having me. I am an internist. I've been in this community almost 40 years, working primarily in the low wealth communities through Jackson Memorial Hospital, through FIU, and I started Florida Clinicians for Climate Action in 2018 with another doctor to address the issues like you just heard of Lydia Lopez. So many issues that we can handle. So it is too hot, but there are things we can do. Thank you.
Thank you so much, Dr. Holder. And next we have Mireille Charles. Mireille, welcome.
Hi, thanks so much for having me. Hi, so my name is Mireille Charles, Mimi, and I'm coming from a different side. I'm coming from the nonprofit side. I'm just retired and is now working as a community doula. But most recently, and my proudest moment is my training as a climate health educator with the Florida clinicians. So this is, you've heard from everyone, including Lydia, who my heart goes out to, how it's needed. This information is needed out there. So I am grateful to be able to provide this information, to work with my clients, my doula clients, and provide them with this needed information. Thank you.
Thank you so much. You all were amazing. That was like less than like a minute. Thank you. So now we're going to move on to our second section is what you should know. What is really what we should know about the effects of extreme heat and how it affects pregnancy health. And we're going to start with you, Dr. Holder.
Yeah, I have some slides. And when you hear Lydia's story, it's pretty unfortunate My heart goes out to her and all the other women in the fields and in the nurseries that are suffering with this heat, especially during pregnancy. And we talk about pregnancy, and it is not an illness. And throughout, we know this as women, we know this in our society, but we put our pregnant women in situations that then increases their risk and increases the medicalization of handling a condition. Next slide. Uh, you saw the slides that Z showed, and just as the doulas and the midwives and everyone noticed what was happening and they were aware, there are studies that were coming in the academic side showing the rise of the stillborn and the low birth weights in the populations. And this was done in 2021. And we saw the areas, Central Florida, and the subgroups that we know this is happening. So the academic world is on top of this. Next. And of course, you heard of the Black women. This study was done looking at 32 million babies, the whole rate across the country. This was Dr. Bekar's study, and they showed it that the heat is impacting populations, especially Black women. Turn, next slide. And you heard of urban heat islands. And this is just basic common sense. You go outside, it's hot, the concrete soaks up everything. Then at night, the concrete sends it back out. And so any areas that have a lot of concrete and less trees, and Miami, unfortunately, I think the tree canopy is at 19%. It's pretty low. So many of our women, especially in the lowest wealth communities, are being basically baked at night. And unless you can afford a lot of AC to bring that cooling temperature down and sleep well, which we know is about 73 degrees, which is very difficult to afford, we're looking at women who start the day already hot and dehydrated. Next slide. When the pregnancy creates so many changes physiologically, because you're now 4'2". So you have to change your hormonal status to be able to provide the protection for the baby. You have to increase your blood flow and blood volume. So you need enough blood for both of you, the baby and the woman. And you feel, if you've ever been pregnant or you talk to any pregnant women, they're always already a little hot because of this increased flow, increased work in the cardiovascular system to maintain a positive environment for the baby. So you'll see with pregnancy, so many risks if you put additional stressors on the pregnancy. Heat, think of you, everybody has boiled an egg. Think of that egg in that boiling water, that heat. You see all the bubbling up. You see the agitation of that egg in the water. You see all of that. And that's basically the pregnant body in heat. Definitely, you will see the adverse impact. Next slide. The mechanisms, and I throw this in for the science and the doctors there, of course, the mechanisms will be multifactorial. It will be how much hormones, how many catecholamines are put out, the prostaglandins, what happens to the blood viscosity, how much blood is circulating, what happens to the blood vessels that flow, the respiratory rate. So many areas are impacted. But when you take the physiologic, that's the doctor side, next slide, you break it down into all the areas, and it's very basic. It's what's in the brain, what's in the heart, the kidneys, the blood, the immune system, the hormones. You put it all. Immediately, everybody's skin will sense the heat, just like the pregnant woman. That sensation then makes the blood go out to try and cool. You need the blood for the baby, but you're taking some of that blood away from the baby. So, of course, it means that the placental flow that goes to the baby in the womb will be reduced. So, if that mom cannot drink, and you heard Lydia says she has this thirst because that's that body saying, I have to drink for two. I need more than what we normally would drink because I already have a baby and have not compensated well enough. And now the additional stress. That leads to dehydration. The dehydration then leads to problems even more with low birth weight, the placental not getting perfusion well enough, increase in the preterm labor because the baby, you start choking off the system and then the body says, let's deliver. They've shown studies across the world, 1 week before delivery, if that mom is exposed to heat at these levels that you saw, that Zainab in the red, that mom had a 7% every time, every day of exposure, 7% increase in stillbirths. That is tremendously complicated for the mom. Inflammation, every time your body gets that exposure, the inflammation goes up. So then more complications to the baby. And then even after the baby is delivered, that breastfeeding becomes difficult because the mom is not as hydrated, the milk production is not the same, and the irritability with the heat. Next slide. So we're looking at tremendous complications. That's my last slide. The pregnancy is a condition. It is not an illness. So we as society can work together to look at all the factors that the pregnant woman is living in. And that's why we at FCCA bringing this information to the doctors, to everyone involved to make sure that we can protect the moms. Thank you.
Thank you so much, Dr. Holder. That's such important information, especially after we heard Lydia's story, right? Really grounding into what her body was going through these 2 pregnancies that she had to go through while working as a nursery worker and not being provided enough water or rest, right? So we really start to understand what is going on in the body. Thank you so much. Mireille, up to you.
Yes, I'm going to bring back Lydia because she brought me back full circle, because I started looking at this work, moving into this work back in 2018 at the Georgia Farm Workers, where I was a volunteer doing interpretation for Haitian Creole with Emory University's PA school. So I have met a few Lydias in 2018 and 2019. And therefore, this is where I started being involved with the Human Rights Watch, and then later on with Metro Mommy Agency, where I trained to become a doula. Now, you heard it from several folks already, especially regarding the doula work. We needed some help in that sense, because right along with a birth plan that you're working with a client, especially me as a community doula in my neighborhood, in my area in North Dade, I see a lot of immigrant clients, especially Haitian-speaking clients, that I'm supporting. And this information, and if you know North Miami-Dade, we are not only heating up right now, but also we have flood risk, and we are also in hurricane season. So once I had the opportunity to be trained with Florida clinicians, we actually, Dr. Holder and I were able to sit with a client not too long ago and kind of go through this client resiliency questionnaire that I've been trained on, and to see the risk, the client's risk. So this climate resiliency questionnaire has a 3-part. It's just the yes or no questions, and it's just 3-part. The first one is on the climate and the heat risk, where you just ask the client about their living condition. Do they have a functional air conditioning, or do they just have a fan? And then just yes and no question. If they don't, then the next step, that they are high risk for the heat season. The next part is about flooding. Do they live in a flood zone? And we can share a map with them. And I think I sent a link to that map, where you just put your zip code, and it will tell you if you live in a flood zone, and how how extreme it is. And then the last one is about, again, emergency response for any of these: flood, hurricane, because again, we are in hurricane season, and figure out whether they even know for even know where they're going if they are misplaced. Do they have a point of reference where they're going to meet their family? If they are too hot in the house, do they know where a cooling center is, or a cooling zone is, a mall nearby, a center anywhere, a movie theater. So with that, once we gather all this information and get basically a score between 0 and 6, 0 meaning that they are extremely high risk and unresilient, and a 6 mean low risk, minimal, low risk, and more resilient. So once we did this with this client the other day, she's in her late 20s. She was getting ready for a C-section, and we did realize that she did not know that she was in the flood zone. She did not know any cooling center nearby. She thought the best place to cool down was a car. So we're now moving forward to working with her to help her create a plan moving forward for not only heat, for flood risk because she's in a flood zone, but also emergency preparedness. One thing that we noticed, and she too was very thankful for it, is her emergency plan for her two other children, was to have her parents pick up the children from school and take them wherever they are designated. But what she did not realize is that her parents also live in the same household. So she now is thinking about adding somebody else to her emergency list. So all these little details are very important to a family or a pregnant person and their family. So with this tool, we are now able to go back, and once she just actually gave birth, once she's feeling better, we going back and helping her to have her emergency preparedness ready, move forward.
Amazing.
So my call to action is that we not only need more.
Can we save that
doulas.
for the next section, Mimi? That's my next question.
Right.
Can we save it just really quick? Thank you.
We not only need more doulas to be trained to do this work, but we need the help of everyone. Everyone can make a difference by giving basic information, but also the health professionals. They need to help us to support those doulas. Thank you.
Thank you so much. We'd love for you to elaborate a little bit more on that as well as we move next to our final section. And we're launching our second poll. And then this next section is really, what is the call to action? What can we be doing about it? And we're also going to be joined by Oscar from WeCount. Oscar, I didn't ask you to introduce yourself, and I'm so sorry. So once I call on you, please feel free to introduce yourself as well. So we'll start with you, Dr. Holder.
Introduce myself again.
I'm sorry, and I muted you accidentally. No, just like, what are the solutions? What's the call to action?
Solutions. Okay. What we've heard from Mireille was the solution that we work together with some of the doulas in the community. And what Z said, that looking at the pattern, who's the best person there? We know clinicians are one of the most respected and trusted voices. And of clinicians, we talk about nurses because they're number one. Then pharmacists, doctors, even veterinarians, I think they're number 2 in the last poll. So how do we get these voices really knowledgeable in what we can impact in our communities, how we can spread the word and have people better prepared because the climate risks are real. We've seen Texas, we've seen New York, we've just seen it. It's every day. It's just your turn. When it's your turn, what do you do? So we need to mobilize everyone. So one of the solutions we saw was mobilizing the clinician workforce. And doulas are the ones who are most likely to spend time with patients. Lydia said the problems of just getting to the doctor. It's not only just outdoor workers, but it's almost everyone who does not have actual resources. So we're utilizing doulas and again, community. We all play a role. We all work with, see pregnant folks around. There are things we can do. Just make sure the woman has water. You can even pay for some people's water if you're in the room, in the line at Publix and they're picking something up, said, oh, I'll pay for your water. Something to spread the message about hydration and heat and the protecting everyone.
Amazing.
So, thank you.
Thank you so much, Dr. Holder. Mireille, is there anything else that you'd like to do for a call to action?
Well, I think that I have to thank, I did not know about the billboards from the Women's Fund, and I think this is excellent. I went to my OB/GYN not too long ago, and there was a sign there that says, just plan water, rest, shade, just that, just a sign. And I thought that was fantastic. So the more awareness, the better. FCCA goes out there in art fairs. In health fairs to give information, and I support as much as I can. I volunteer to do those. So yes, the more information people get, the more education people get, the better.
Can I also add that we need policy in addition to what we can do individually and what we can do as a health systems, but we do need the support with policy. And like OSHA is going through guidance right now to be able to ensure that people, the employers, will provide water, shade, and rest and protection. And that is now, we just did the hearings and FCCA testified to the need, but we need the community also to call their politicians and tell their politicians, this should not be a Republican or a Democrat issue. This should really be about protecting people. And we depend on farm workers for our food. I mean, that's who's, we depend on everything. So we need, and outdoor workers are not just farm workers, the school crossing guards, the police officers, the firefighters. There are a lot of folks who work outdoors, the construction workers. They do need protection. And if the community calls the politicians and say, pass the OSHA regulations that insist that the employers protect the workers, I think that'll be something we really need. And this is perfect timing for it.
Thank you so much, Dr. And that's a perfect segue to Oscar. Please tell us, please feel free to introduce yourself, and then please tell us about all the work that you have going on at WeCount.
Sure. Hi, everyone. I'm Oscar Londoño. I'm the co-executive director of WeCount. Thank you to the Women's Fund for organizing this event and for the partnership over the years. Yeah, I think you heard it directly from Lydia, who's a member of WeCount. She spoke for herself. I think I've learned so much over the years directly from the outdoor workers who have for years been sounding the alarm. They're the frontline experts who are helping us all understand what the core solutions are to this moment. For years, WeCount advocated through its Que Calor campaign for the basic components of water, shade, and rest for outdoor workers. We got really close in Miami-Dade. Many people in this call, I imagine, supported our campaign. And unfortunately, the Florida legislature preempted our efforts in Miami-Dade and in every city and county in the state, making it illegal for some of our local governments to take action on this issue. That's really what prompted the birth of Planting Justice, which is our new campaign that's driven by plant nursery workers like Lydia. If you've ever bought a house plant, an indoor plant, whether it's a snake plant, a monstera, a pothos plant like the one behind me, if you've ever gone to a Home Depot, a Lowe's, a Costco, an IKEA, a garden center, and bought an indoor plant for your home or for your office, it's very likely that it came from workers like Lydia. What people don't know across the country is that the majority of these indoor houseplants are being produced in Florida, and that Miami-Dade is the top producing county of any county in the country. And so whether you're in New York or California, Colorado, or here in Miami, those plants are being made by thousands of largely immigrant workers, and the majority of them are women. And unfortunately, too often, the people who are buying these plants, the consumers, by design, we don't really know what's happening at the bottom of the supply chain. We see a beautiful plant for our home. We see the price tag. We follow plant influencers, but very, very, very rarely do we ever think about the workers who actually touched that plant and made it possible for that plant to reach our home. Currently in Miami-Dade County, there are more than 1,500 registered nurseries. Nurseries that employ tens of thousands of workers across the state, workers who are planting, who are weeding, who are spraying chemicals and pesticides, who are lifting heavy plants, who are transporting those plants, an entire sort of assembly line of work, also that these plants can arrive at our homes. And also that these big box brands that are generating billions and billions in profits, right, can bring those plants to millions of consumers across the country. And so what is Planting Justice trying to do? It's trying to build a grassroots movement, not just of plant nursery workers like Lydia, but of consumers as well. Every single person who buys a houseplant should join the calls of workers like Lydia who are demanding water, shade, and rest in their workplaces. And in a moment when government refuses to take action, whether it's Miami-Dade County, whether it's the state of Florida, or whether it's the federal government, there is a path for workers to win these kinds of protections, like water, shade, and rest, like fair wages, like safe working conditions. And the way to do it is a model called worker-driven social responsibility. I don't have enough time to share about that right now, but follow our website, we-count.org/plantingjustice. The idea is We Count will launch a campaign with workers and consumers to try to win binding agreements with big box brands to make sure that they only do business with nurseries that treat their workers fairly, that Lydia can actually go to work in what's becoming record-breaking heat and can be guaranteed, whether she's pregnant or not, right, that she has a right to safety and dignity on the job. So I encourage you all to follow us on social media, follow our website, and whether you're a consumer, an ally, or a worker, every single person has a role to play in supporting Planting Justice. And so thank you so much for giving me time. And in the future, I'd love to do an entire impact collaborative on Planting Justice.
Duly noted, Oscar. Thank you so much. We really appreciate it. Because we're a little short on time and I'd like to get to some of the questions in the chat, we're going to move on to our Q&A section. And while the Q&A is happening, please make sure to fill out our third poll. If we could stop sharing the screen, that'd be great so we can see everybody here that is going to be part of the Q&A. Amazing. Okay, so our first question is, what is the OSHA Employee Outdoor Protection Bill that is pending approval?
It's not a bill. It's part of the regulations. OSHA has about a 7-year process to be able to improve the guidelines and regulations on how workers function in America. There are guidelines that every employer now uses to guide them in what to do about heat. And unfortunately, these guidelines do not make them mandatory. So that's the difference between guidelines and mandatory regulations. So every employer, including Lydia's employer, says, we follow the guidelines. We do it. We make sure they get water, shade, and rest. However, it doesn't say how frequently, how often. It doesn't give ways of when a new worker shows up, how you should gently introduce them to the work, how much time they should have. It doesn't give specific recommendations. And this is where we say in the new OSHA guide, the new OSHA rules, it would be specific regulation that says at this temperature, whether you use wet bulb or you use heat index, and you saw Zainab did the whole separation of which is which. And if you're an indoor worker, the heat index works well. If you're outdoor, you do need to know if the sun is coming at you and if there's any wind moving on you, because your body cools using all that information. So this is where the regulations specifically say this is what we do. So they were passed in the Biden administration. But unfortunately, when the Biden administration switched to the Trump administration is not supportive of the concepts that we have said based on what the science. So without that support, we are now having hearings, which you must do with every policy change or any department. And now the hearings and the administration is not as supportive as the previous administration. So we need all the voices to say, follow the science, protect the workers, mandate that the employers do the right thing. Some do, but not all of them. And that's just the reality of our world.
Thank you so much, Dr. Holder. Maria, I see you have a question in the chat. Do you want to ask it in the minute that we have left?
Looking for pragmatic solutions. Like, I do go to Homestead, I do buy plants, I do buy vegetables, flowers, banana trees. How do I know who I should go to?
Yeah, and so I put a link for the Planting Justice website. The program itself will allow consumers to make sure they're only investing in nurseries and in big box brands that actually join our program, where WeCount can actually certify and monitor in these nurseries workers have the protections that they need. So I'd say join Planting Justice, follow our website, and sign up for the list for updates.
I love that. Make your money do your talking.
Amazing. Thank you so much. And I'm so sorry. Like, I wish we could keep going, but because we're at time basically. Team, if you could share your screen again, just to last couple of things to wrap up. And I want to thank you all for being here, for taking the time this early Thursday morning, after I know some like vacation and some holidays. So thank you so much. Want to invite you all to join us for our next Impact Collaborative. That will be actually a town hall with the mayor. We don't have a date or a
We
date.
do.
Oh, we do.
July
Okay.
30th, 6 to 8 p.m. Hot off the presses. The only thing that we like that's hot is the information confirmation. The town hall, Daniela Levine Cava and her team showing us the Miami-Dade proposed county budget and how it will affect women and girls, very specifically with the gender lens. It's a very tough budget year. So show up in droves, please, because many of us are going to need to support our government and compensate for funds that aren't there.
You got it. Thank you.
And we have an exit survey that you will be getting in your email. If you could please fill it out, that'd be great. Thank you so much, everybody. To our amazing speaker and panelists, thank you so much. We so appreciate you. Oscar, please give our profound thanks to Lydia. She's amazing.
Amazing.
She's amazing. She's doing the work, and we're just so super grateful.
Courageous to be
Yeah,
able to do it
very much.
Thank you so much, Dr. Holder. Thank you so much, Mimi. We appreciate it.
My pleasure. Talk soon.
Yeah, Z, thank you so much.
Okay, bye.
And thank you, Vivi.
Oh, thanks.
Thank you, Myra. Thank you, Vivi.
Myra, everything's good?
I tell you, we have to take up more space and have louder voices and work more and more closely together than ever.
There you go.
Things are going to be better as we all keep on showing up. No time to get small, time to get big.
Thank you for doing the work.
Bye-bye.